Hi, everyone. Welcome to Access Chat. Today we have Daniel Mont. He's the CEO and the co-founder of the Center of Inclusive Policy, and he's joining us from Washington, D.C. I will say that luckily Antonio was able to join us because he's just getting back from a conference, and Neil is still at Zero Project in Vienna, so he was not able to join us today. But Daniel, thank you so much for joining us. Do you mind telling the audience a little bit about who you are and how you became the CEO and co-founder of the center?
Sure. Hi, and thank you so much for having me. Yeah, so I worked for the World Bank for many years as a senior economist on disability issues and poverty issues. And then I left there to found the Center for Inclusive Policy, mainly because at the time, it was about 10 years ago, right after the Convention on the Rights of Persons with Disabilities, the issue of disability inclusion had become very prominent, and the disability community had become very good at advocating for themselves in terms of awareness raising and trying to promote, their rights of people with disabilities. But then we transitioned into a stage where people wanted to know, well, what exactly should we do about this? Okay, you've convinced us that the people with disabilities are a significant, important part of the population. You've convinced us that there's gaps in the exclusion, there's barriers, and that need to be addressed. Now we want to know, what are the effective and efficient ways to try to address these problems? And the way I like to put it was that the disability advocates were very good at getting into the room, but not so great at saying what they wanted once they got in the room, because people wanted evidence-based information. People wanted specific policy actions that could be taken to address these things. And so what we had a community of different disability organizations that knew an awful lot about disability and what it means to live as a person with a disability in the world, but not a lot of detailed information about policy analysis or evidence-based advocacy. On the other side, we had people like in UN-type agencies of the World Bank who know a tremendous amount about policy and gathering evidence, but not a whole lot about disability. And so we thought this is a nexus where we need an organization that was able to sort of catalyze action between the two groups. And so we do research, but we also do advice, technical support and capacity building. And we're involved with various governments with implementing various policies. Again, trying to find out what are those knowledge gaps, what are those frameworks for thinking about building inclusive policies that need to be constructed, and then trying to catalyze action between the different stakeholders so they can actually achieve real world improvements for the lives of people with disabilities.
Well, I know that this was needed, but it also seems like at a time where, for example, you and I are both in the lovely United States of America. And I know everyone's very confused. Just saying there's just nothing but chaos. So it seems like during this chaotic time, we need your group more than ever before.
Well, I think we really need to be able to show concrete information and to come up with realistic, effective strategies for addressing these things. And there's several components to that. One is the awareness raising. Now, what is the percentage of the population that has a disability? And what I always like to say, it's not just the percentage of the population that has a disability. It's the percentage of the people who live in households with the person with a disability. Because if your child has a disability, if your spouse or your parent has a disability, then the extra costs that those people face, the discrimination they face, or whatever it is affecting the whole household. And when you look at it that way, it's about 25% of the population. So this is not a small group of people. This is a big chunk of us. And then the question is, how does that play out in their lives? It plays out differently depending whether you're a child or an old person, depending whether you have, say, a physical disability or a psychosocial one. And so it's a complex area that really needs us to then really uncover what are the mechanisms that are creating the exclusion. And it's significant. I mean, the International Labor Organization did a study, which their estimates were that GDP would be about 4 to 7% higher if people with disabilities had the same access to labor markets and jobs as people without disabilities. And 4 to 7% of GDP is nothing to sneeze at.
No, and it seems to me that, and I'm going to turn it over to Antonio, that you're actually talking about human inclusion. making sure that humans are included in every single phase of their life. And I'm one of those families that I didn't know that I'd ever met anybody with a disability till I had a daughter with Down syndrome. And then I realized as I got in the field, I'm surrounded by people with disabilities, including myself, because it's just part of the human experience. But Antonio, over to you.
No, I think we talked on this podcast before about reliability of data about people with disabilities. And we often realize that there's plenty of data out there that is not good enough to our purposes. And sometimes we throw data about, we have 15% of people have a disability. When we dive deep into those numbers and to the origin and the source of the data, we realize that in some cases there are data that is a decade old, or some countries are not updating that data for a long period of time. So then how can we get more reliable data on this topic?
This is something that we've worked really hard on since about 2003. The UN Statistical Commission had a big global conference to address this problem. We have really lousy data on disability. And from that, they formed a city group. The UN Statistical Commission, when there's a tricky measurement issue, they form these things called city groups. And they invite the national statistical offices of all member states to come in, who want to come in and work on the issue. Unfortunately, it's always named after the first city it meets in. And the first city it met in was Washington. So people have heard of the Washington Group questions, and they think, this is a U.S. thing. No, it's an international thing. And dozens of countries have worked on these questions. And the questions were designed for a census. And because censuses are expensive and space on them is very dear, the goal was to create the shortest set of questions that could identify the most people who have a disability. And what is the definition? There's so many definitions of disability. And the definition that was decided for this purpose was people who had functional difficulties that put them at risk of exclusion if they face barriers in the environment. And there's a certain set. And this is the data that is used now as the international standard for prevalence, okay? But we know that it's not complete. We know it's not complete because there's a Washington Group extended set that addresses psychosocial issues, which are not really part of the original Washington Group questions. And then there was an issue with the Washington Group questions because they're not so great at identifying children with developmental disabilities. So UNICEF and the Washington Group came up with the child functioning module. And then the WHO came up with the model disability survey, which is much longer, right? And so depending on which instrument you use, you get a different number. And then all of these things, whether it's the Washington Group questions or the model disability survey questions, they're designed for statistical purposes. So in the population, are you identifying a big enough percentage of people who you're trying to identify with enough accuracy that we can make general statements about what's going on in the world? People with disabilities tend to be older. They tend to be poor. They tend to, but they're not anywhere near good enough for, say, determining eligibility for a disability certificate, right? There you need much more detailed information, right? And then you have to think about chronic conditions, pain and fatigue. That's included in the Washington Group extended set, not included in the short set. So depending on which data tool you use, you're going to get a different number. And also another thing to keep in mind is that disability really is not a binary variable. It's not like there's two distinct populations in the world, with and without disability, right? For example, functional difficulties exist along a continuum. So you have to decide where you draw the line. At what point do these functional difficulties rise to a level where you say, now they're really putting people at risk of exclusion because of barriers in the environment. This is the line I'm going to draw. And it's got to be, in some sense, I wouldn't go far as to say arbitrary, but it has to be predetermined for some purpose. And where you put the line really matters. Because if I make the line really high level of functional difficulties, I'm going to get fewer people, but they're going to have a bigger gap in like employment or poverty. I could say, no, I want to include all these other people who have functional difficulties which aren't as significant, but I still think they matter in people's lives. Well, I'm going to get a much bigger number, but the gap is going to be smaller because they're not facing the same degree of barriers, right? So I think it's important. So do we really want to have two numbers, with and without disability, or do we want to have a gradation? So you have to always think about what's the purpose for me coming up with this number? What's the purpose for me identifying people with disabilities, and then choose the proper tool and the proper instrument. And so it's a little bit nuanced, which is unfortunate because everybody always wants to know the number. What is the percentage of people with disabilities? And in my mind, there's no such thing as the number of people with disabilities.
No, glad you said, because I'm a sociologist by training, and I always have difficulties when I see campaigns pointing to a number. When I see that disability is just something that is part of us as humans as we go along our lives. It's so then the numbers sometimes they seem to come. People might have a very genuine good intention of coming up with a number. Here's the number, but in the end, I don't think it tells the real story. And I think we need some kind of shift. In some countries, populations are aging, and people are above a certain age. They represent most of the population in certain nations. In other countries, is not as much. So I think we need to have a different look into that topic.
It all comes back to the purpose. So if I'm trying to design a public policy program to provide assistance to people with really high support needs, right? All right, that's a small percentage of the population, all right? But I want to identify those people. If I'm building a public transportation system and I want that system to work as well as possible for everybody, how many elevators do I need? What is the space? I don't design infrastructure, but there's various things that go into designing infrastructure. Then I want to know about all the functional issues, the ones that are temporary, right? The ones that are very significant, but also the ones that are a little less, because these are people who are going to want to use the elevators and not going to want to use the escalators, even if they don't sort of qualify for a disability certificate for my public program, right? So depending on my reason for identification, I'm going to use a different definition, a different threshold, and one number doesn't fit all purposes. And that's a hard message to get across. And often disability advocates, sometimes I see them fighting for the biggest number. Oh, I want to get the biggest number. I say, well, no, you want to get the number that's right for your purpose. Yes, I do want to know in the United States that whatever 16, 18 or something percent of the population has a disability, but I also want to know that only 2% of them are going to be getting SSDI. And yeah, anyway, I'll stop there.
No, because it's such an important point, because we're making decisions on terrible data. I remember when I've written a couple of books about this, and I've just tried to, I didn't even go there, Daniel, what you were talking about. I just gave them two definitions of disabilities, one with the ADA and one with CRPD, and they're different. And so the brands are like, well, Deborah, I'm confused. And I also want to say, I think we make a mistake also by these ridiculous numbers that we cannot prove. We sound stupid. There was one that we did forever in the United States. I don't know if people are still doing it. The United States has $220 billion of discretionary income. And if you are not including people with disabilities, you were leaving that money on the table. You were just wasting it. That's like, okay. Now I started hearing that number 2002, 2003. Nobody could ever tell us where it came from. It wasn't grounded. And you tell that to the customers, and they just think there's so many ways they can think, right? You obviously don't know what you're talking about. Because that is not true. When we're not leaving out 220. But what's happening is, and what I have been trying to talk about is, because we do need numbers, blah, 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 blah. But the reality is you are excluding customers. If you were a brand and you are building something and you're a bank and you want us to use your savings accounts, your checkings account, your different things, but you're also going to upsell me so I can use all these other cool services and apps. If they're not accessible, I can't use them. And my family members can't use them. And so we're barely using the basics of your services because they're not accessible to all of our family. So I think it's almost like we're having the wrong.
Deborah, let me tell a story. This happened. I was at an event last year, a technology event, and I was in a room with a lot of people from media and press. And someone will, oh, Anthony, why you do this podcast and why do you care about accessibility? And I was okay, someone needs an argument from me. And I asked this, can you please remove your glasses? Can you see what is written in the board in front of you? No. Can you see the door of the room without the glasses? Oh, I can't. When you are going down the stairs, are you able to go down the stairs without wearing glasses? No, I can't. So I care because I know when we are in place like this, we need to make sure that everyone is included. Everyone can see the screen. Everyone is able to see the door. So it's not just why I care about disability. I care about me. I care about you. So I think it was the shortest way I could find to tell this person why it matters.
Yeah, and it reminds me when I was at the World Bank and we were talking to some an island country in the Caribbean, and trying to get them to focus on this. And they were like, we have a lot of issues. Why should we care about accessibility? Why should we care, but why should it be a high priority for us? And we said, well, where's your economy coming from? It's coming from cruise ships. Your cruise ship docks at your port. Who do you think is on that ship? A lot of old people. Who takes cruises? You want those people to be able to comfortably get off that ship and come into your town and spend money. It's economically worthwhile for you. And that's when they perked up and they said, yeah, you're right. This will help our economy to be able to have helping these people be able to participate in our economy helps the economy for all of us. And another thing is, sometimes thinking about accessibility for people with disabilities leads to innovations and products that apply to everybody. I think voice recognition is the key example that people usually mention. That the first attempts at voice recognition, a lot of it was focused on letting people with disabilities be able to use the computer, be able to type, now think about all the uses that we have for voice recognition. Or closed captioning. You just have to be in a bar or an airport and see that closed captioning come across the television while you're sitting there. Where do you think the impetus for that came from? It came originally from thinking about how to include people with disabilities, and now it's something that's a benefit for everybody.
And I love that we have so many beautiful examples like that. Why do we have the telephone? We have the telephone because Alexander Bell was trying to create something to communicate with his wife that was deaf. So there's so much beauty why do we have, anyway, I could go into so many.
When Steve Jobs was about to develop the iPhone, one of the apps and a startup that he went to buy was a startup that was building software for people to be able to navigate within interfaces that led us to be able to use the iPhone with our hands. It was the first thing that he went to buy because it was a way to facilitate everyone's navigation with the phone.
I know it's sort of beautiful, but let's go back. What I'd like to do just to make sure that the audience gets as much out of this as possible, Daniel. But we see obviously there's a lot of chaos and we see a lot of people being laid off. Certainly in the United States, if they have anything to do with DEI and maybe DEIA, sadly, I know the United States government the White House removed accessibility from the website, which made me sad as a citizen, but that's okay. But I guess really what I would wonder, we can talk all day about what the problems are. But what I am wondering, Daniel, is how do we navigate forward? How do you recommend that we all navigate forward? I know there's like right now, Zero Projects happening in Austria. I know that there's a big event coming up in Berlin with, IDA. We're having conferences, we're talking about it, but it sort of feels like we forgot what we were trying to solve in some ways. It's starting to feel like to me.
Yeah, I wish I had all the answers on. I know that a lot of countries are making progress. And part of what they're doing is collecting better data and collecting data designed to try to help them implement policies. And I can give you some examples. At the same time, in the US, we seem to be jettisoning our data. Like, was it the health, the retirement? Some of the key surveys that were collected to help SSA monitor its programs have been eliminated. So we're just sort of like cutting off the sources of information to even be able to see what's happening, let alone try to see what opportunities there might be to include things. So seeing those sources of data disappear, it really cuts off any action or any informed action. So it's nice to see around the world a lot of countries trying to improve their data management information systems and collect better quality data that's more useful for making policy decisions. You see that starting to emerge in places, and it's very disheartening in the U.S. to see us trying to, throw all that away. I mean, we talk about wanting to be efficient and effective in how we run our programs. How can you be efficient in how you run your program if you don't collect information about how it's working?
I know. And it's interesting also. I know that both of you brought it up, the aging data, because the reality is every single country is dealing with the aging issues. I'm one of the people that are part of the aging issues, but it, it's it does seem scary to be turning off good data right now because data is getting us in trouble. But I do think that coming together, and I agree with what you're saying, Daniel, I'm also seeing a lot of very interesting innovations happening in other countries, seeing lots of happening in Asia Pac, in the Middle East and the MENA regions, but also seeing very interesting things happening in Central and Latin America. So,
One
I'm
thing
all.
that's encouraging in other countries. So, in the United States and some other places, just to show you have a disability to get benefits, you basically have to say that you can't work. Disability is defined as not being able to work. And so it creates this terrible problem of like the only access you have to benefits that might cover the costs of disability costs. Sometimes the main access to health insurance in this country is by proving that you can't work. Whereas in other countries now, the move really is towards no, disability is not associated with an inability to work, but the disability benefits should be going towards the extra cost that people with disabilities face in order to live, right? If I have a disability and you don't, I need more money in order to accomplish the same basic things, whether I need assistive technology or a personal assistant. There's a whole range of things. We're doing studies around the world on this, a bunch of countries truly trying to document where these extra costs come from, trying to think, well, how can we design public policies that address these extra costs and the great variety, because people with different types and degrees of disability face different kinds of costs. So the idea is, let's have a social protection system that makes an equal playing ground, provides for the extra costs that people with disabilities face. And then if you're poor still, because you might still be poor, you can qualify for the same anti-poverty programs as anybody, right? But not associate disability benefits as, these are poor people. We don't want them to starve in the dark, so we'll throw them some money. Instead say, no, we want to provide them the support they need to be able to function on an equal basis with
Well said.
other people. But you need information in order to design. And countries are trying to move in that direction, which is not really how the U.S. does it.
No. And the problem, if you don't move in that direction, is that you might have a country like ours that's doing right now. You just see a whole bunch of money being spent. Is it being spent well? Is it being wasted? Is there corruption involved? They're just so big. And my daughter with Down syndrome is on government support. And I am working really hard to not rely on that. But it's really frightening for the families as we walk this. But, oh, well.
Right. And what they're going to do to IDEA, who knows?
Yeah. And 504. Right. And so, right. And it's unfortunate. But we wanted the audience to know about what you were doing. And maybe they already knew about what you were doing, but we wanted to make sure that they did, because I think you're more important than ever in the role that you're playing now. And you know what, Daniel, I did not know that nuance that you mentioned about why it was called the Washington. So I did not realize that. I remember being one of those people thinking, how come? I just did not know that nuance. Thank you for explaining that to me. I know that we want to, and we'll do that real quick. We want to thank our sponsors, Amazon. Thank you. Thank you, My Clear Text, for supporting this show. We're 11 years old. We really are grateful. But Daniel, we also want to make sure, can you tell the audience how to connect with the Center on Inclusive Policy? And also, Daniel, how do we work with your group? For example, would a corporation come to you and say, hey, we want to help get that? I mean, give us an example of how customers would come to you.
Well,
If that makes sense.
our website is inclusive-policy.com. policyorg. And you can get on there and you can see all the things we do. We're a nonprofit, nonprofit. Yeah. We like I said, we really work to try to help develop policy information frameworks to promote inclusion. And we work very much in the social protection, employment, support needs for independent living, improving data systems. Those are the areas we work in. And if people are interested in, if people have ideas of things they're doing in that area that we could work with, or if they want to support us or just learn more about what we're doing, we'd love to be in contact with anyone who's interested in that area.
Yeah, and we want you to come back on and talk to us more about this as it evolves, because I think losing the little bit of data that we had, it's a little frightening, but I also know we're all stronger together too. But Daniel, thank you for being on the show. Will you tell us one more time what the the URL is?
Sure. It's inclusive-policy.org. And you can contact us through there.
All right. Thank you so much. And thank you to the audience. See y'all next.
And thank you for having me.